loading washer. Racks are prepared to fit over the open ends of ampules or vials as they are found in shipping cartons. Carton is inverted to transfer the containers to washer without handling them individually. A battery of jet tubes is arranged to enter each container positioned in the rack. The clean containers may be removed in the rack and transferred to a box for dry heat sterilization and storage. The production area where sterile parenteral preparations are manufactured can be divided into 5 sections. First one, cleanup area. Cleanup area, it is not an aseptic area. Cleanup area should be constructed to withstand moisture, steam and detergent. Ceiling and walls can be coated with materials which should prevent the accumulation of dust and microorganisms. Exhaust fans should be fitted to remove heat and humidity for the comfort of persons working in this area. Second one, preparation area. In preparation area, the ingredients of the parenteral products are mixed and preparation is made for filling operation. Cabinets and counters should be made of stainless steel and they are filled in such a way that no space is left for the dirt to accumulate. Ceiling, walls and floor should be sealed and suitably painted to keep them thoroughly clean. Third one, aseptic area. Ceiling, walls and floor of aseptic area should be sealed and painted so that they can be washed or treated with aseptic solution or sprayed before use. The air in the aseptic area should be free from fibers, dust and microorganisms. This can be achieved by the use of high efficiency particulate air filters (HEPA), which can remove particles up to 0.3 microns. HEPA filters are fitted in laminar airflow system in which air free from dust and microorganism flows with uniform velocity. Ultraviolet lamps are fitted in order to maintain sterility. Fourth one, quarantine area. The random samples of parenteral product of different batches are in the analytical laboratory for its evaluation. Those parenteral products which passes all the quality control tests are transferred into finishing or packaging area. Fifth one, finishing and packaging area. Proper packaging is essential to provide protection against physical damage from transportation, handling and storage. The labeled containers should be packed in cardboard or plastic containers. Ampules should be packed in partitioned boxes. Test for sterility may be carried out by first membrane filtration method, second one direct inoculation method. Membrane filtration method involves the filtration of the sample under test through a membrane filter having normal porosity of 0.45 micron and a diameter of approximately 47 millimeter. After the filtration, the membrane is removed aseptically from the metallic holder and divided into two halves. The first half is transferred into 100 ml of culture media meant for fungi and incubated at 20 degree to 25 degrees Celsius for not less than 7 days. The other half is transferred into 100 ml of fluid thioglycolate medium and incubated at 30 degree to 35 degrees Celsius for not less than 7 days. Observe the growth in the media. Second, direct inoculation method. In this method, the specified quantity of sample under test is drawn aseptically from the container and transferred into a vessel of culture medium. Mix the liquid with the medium and incubate for not less than 14 days. Observe the growth of microorganisms in the medium. The following observations are possible. First one, no evidence of growth, hence the preparation being examined passes the test for sterility. Second one, there is evidence of growth, so retesting is performed using same number of samples, volume to be tested and media as in the original test. If no evidence of microbial growth is found, the preparation being examined passes the test for sterility. There is evidence of microbial growth, so isolate and identify the organism. If they are not readily distinguishable from those growing in the containers reserved in the first test, the preparation being examined fails the test for sterility. They are readily distinguishable from those growing in the containers reserved in the first test. Second retest is performed using twice the number of sample. The preparation being examined passes the test for sterility in case there is no evidence of microbial growth. In case there is evidence of growth, in the second retest, the preparation being examined fails the test for sterility. doing pyrogen testing, we should select 3 healthy adult rabbit of either sex, each weighing not less than 1.5 kg, fed on complete and balanced diet and not showing any loss of body weight during the week preceding the test. Do not use any rabbit having temperature higher than 39.8 degrees Celsius, showing a temperature variation greater than 0.2 degrees Celsius between two successive readings in the determination of initial temperature. The test is carried out in an air-conditioned room. The amount of sample to be injected varies according to the preparation being examined and is prescribed in the individual monograph. The solution under test is injected slowly through an ear vein in a volume of 0.5 to 10 ml per kg of body weight. Clinical thermometer or temperature sensing probe is inserted into the rectum of the rabbit for recording the body temperature. 2 normal readings of rectal temperature should be taken prior to the test injection at an interval of half an hour and its mean is calculated, which is the initial temperature of the rabbit. Record the temperature of each rabbit in an interval of 30 minutes for 3 hours after the injection. The difference between the initial temperature and the maximum temperature recorded for a rabbit is taken to be its response. Then interpretation: if the sum of the responses of the group of 3 rabbits does not exceed 1.4 degrees Celsius and if the response of an individual rabbit is less than 0.6 degrees Celsius, the preparation being examined passes the test. If the response of any rabbit is 0.6 degrees Celsius or more, or if the sum of the responses of the 3 rabbits exceed 1.4 degrees Celsius, continue the test using 5 other rabbits. If not more than 3 of the 8 rabbits show individual responses of 0.6 degrees Celsius or more, and if the sum of the responses of the group of 8 rabbits does not exceed 3.7 degrees Celsius, preparation being examined passes